Use of plasma membrane risks in growth factors in giant myopic macular hole with retinal detachment. Greetings from Colombia. We present the case of a 61-year-old female patient with a history of retinal detachment on 2 previous occasions in her left eye with visual deterioration up to hand motion. The images show a giant macular hole measuring 2,192 microns and associated retinal detachment. With the above information, the patient underwent surgery. We initiated the procedure by performing fluid air exchange to remove the subretinal fluid through the macular hole. Note the difficulty in correctly approaching the instruments due to the high axial length, which hinder complete fluid aspiration. Therefore, we decided to place a more posterior trocar to approach the indicated planes and aspirated the fluid. Once the PRGFM fragment was obtained, it was positioned appropriately in the macular hole. We repeated the procedure with a second fragment. And finally introduced a third fragment to seal the macular hole. We use intraoperative OCT to observe the correct position of the PRGFM. Then we left liquid plasma to improve PRGFM adherence and finally inserted intraocular silicone oil. The sclerotomies were closed, antibiotics were administered, and the surgery concluded. Platelet-rich plasma is a blood derivative that contains several trophic factors and not only facilitates tissue healing but also stimulates tissue regeneration. The technique begins by extracting a blood sample from the patient, which is subsequently centrifuged to separate the blood components, and the second layer of this preparation is taken to later add calcium to activate the platelets and finally incubates it to form the plasma membrane, which is introduced through the trocar after performing the vitrectomy and is positioned over the hole, confirming its location with intraoperative OCT. This is the postoperative result. Note the PRGFM is correctly positioned, sealing the macular hole and the adhered retina, achieving functional and anatomical stability. The best correct visual acuity is 2400. Patients with myopic macular hole should be repaired because the posterior staphyloma increases the likelihood of retinal detachment. The pars plana vitrectomy with PRGFM achieves additional benefits in postoperative closure, providing a safe and neuroregenerative scaffold in retinal tissue. The surgical technique is reproducible and safe even when other techniques have failed.